So this is the home exercises that I want you to do after you've had your shoulder replaced. It's extremely simple, extremely safe, and this is exactly what I want you to do for your shoulder, because these exercises have been proven for decades to be the best balance of trying to get the shoulder moving but not risking loosening the implants or causing excessive pain or anything like that. So it's very simple. So you're going to start off in a chair just like this, okay? And you can do it in a mirror or without a mirror. I think having a mirror is nice because it kind of gets you to check your form, but either way is fine. You're going to link your hands together, and let's say I've had surgery on my right shoulder, right? So it's very simple. My left shoulder is going to now be my therapist. So you're just going to start by just bringing your hands to the top of your head, just like this. And this will be difficult. And what often you'll do is you'll start to kind of tuck your hands like this and do this, and that's okay. Just try to bring it as high as you can, and if you can only get to here, that's where you stop, right? You're going to do this every single day for 3 sets of 15. Now, if you want to do more, you can do more. I would just start off by doing 3 sets of 15 every day, and you're using your non-operative arm to try to pull up your operative arm as high as you can, and the goal initially is to get your hands to your head, all right? Now, some of you will be able to do this fairly quickly after the surgery. Some people, it will take you, a month or two just to even get there. Everybody's different. Everybody starts off in a different spot after surgery. So don't get frustrated. Just try to go as high as you can. Go to where it's slightly uncomfortable. On a scale of 1 to 10, I want 2 or 3 at the most in terms of the pain. I don't want you going to extreme levels of pain. Once you can get to here, the next step is to straighten your arms, okay? And then you bring it back down, just like this. And the goal is to get to where you can easily go here and there, right? Now that will take, for some patients, again, several months to get to that position. It's really just, everybody is unique, and everybody's shoulder starts off in a different spot, and everybody recovers different from surgery. So there's a huge spectrum in terms of how quickly people get better. What's very consistent is where people are at in 6 months to a year. So don't get frustrated. Take what the shoulder gives you. Some days are going to be better than others. You're going to have more soreness some days more than others, but just go to right here initially, and then you're going to go there, all right? And then back down. 3 sets of 15. So do them in the morning, around lunchtime, and then in the late afternoon. The other exercise I want you to do is where you basically are just going to take your other hand and you're going to lift up this way, okay? And you're just going to hold the arm right there like that, all right? Now, there's 2 types of shoulder replacements. If you've had the standard anatomic, okay, this is important. For the first 6 weeks, I just want to here, okay? I don't want this after 6 weeks. If you've had a reverse, then you can go here and here right away. So again, if you've had the anatomic shoulder, right? If you had the anatomic shoulder, we just go to here for 6 weeks, okay? That's it. If you've had the reverse, then you go here, here, you can do that right after. So I also don't want you going behind your back, or if you look at my arm here, I don't want you rotating more than 10 degrees out this way. So don't be grabbing things out like that. You want the arm to stay kind of tight in this way. So this plane is okay. If you're an anatomic, I don't want you going above 90 degrees for 6 weeks. All right, so keep it below 90. Reverses can go as high as they want right away. Nobody goes behind the back, and nobody lifts more than 5 pounds for 3 months. Those are the main things. The other exercise again is just taking your other arm and holding it here and then trying to hold that position there at 90 degrees. Just statically hold that position. You can do that for the first 6 weeks if you want to try to add something else in there. But really the core exercise is this one. And if you look, for the first 3 months of surgery, our main goal is to try to get your arm fully elevated. That's it. Nothing else matters as much as that. Like getting your arm all the way up to 160 degrees of full elevation. And then after 3 months, we can start to strengthen and do all these other things. But if you look, what do you need to do that? That's full elevation right there. And your other arm is your therapist, really. And you have to use your operative arm some to do that, but it's a combination of like active and passive. So that's why I love it so much. So again, to repeat, everybody does this right away after surgery. If you've had an anatomic shoulder, you just go to the top of the head for 6 weeks, and then you can extend after 6 weeks. And the reason for that is the subscap repair. For reverses, the subscap repair isn't quite as important. So for anatomics, it's vital. So reverses, we let you move a little bit more freely from the beginning. But really, that's the home therapy program. So just do this on a daily basis, 7 days a week if you can, and you'll see progressive gains through your shoulder. And then you can just start to strengthen it 3 months on your own, or we can always do, our digital therapy platform or our in-person therapy platform at certain times along the way. But for the first 3 months for arthroplasty, I really prefer either the digital platform, or if we can't get that set up, then doing this home therapy where I'm just showing you these simple exercises, and that's plenty, honestly.